Good morning, viewers. I'm here with Dr. Fatima Inu Uba, consultant clinical oncologist.
Thank you for having me.
April is Testicular Cancer Awareness Month, and this is a good time to learn about testicular cancer, risk factors, symptoms, and testicular self-examination. Please, ma, kindly give us a brief anatomy of the testis.
The testis is part of the male reproductive organ. It's responsible for sperm production and synthesis of hormones. It's being shaped, located inside the scrotum. It's about 3 to 5 cm in length and then 2 to 3 cm in width.
What is testicular cancer?
Testicular cancer is a disease in which the cancer cells develop in the tissue of the testis. The cancer cell can further divide and grow out of control to spread to other parts of the body. The nodes, lungs, liver, brain, and even the bone.
What is the epidemiology?
Testicular cancer is the commonest solid malignancy among young men between the age of 15 to 35 years. It is rare. It represents 1% of adult malignancy and 5% of urological tumors. It's commoner in white than in black. It's an indolent cancer.
What are the risk factors?
Undescended testes. When the testes did not descend before birth. Family history of testicular cancer. First degree relation, father, uncle, brother having testicular cancer. Abnormality in the penis. Hypospedia. Abnormality in the urethra. Klinefelter syndrome. History of exposure to radiation. Personal history of testicular cancer. A young man that has previous history of testicular cancer is at risk of developing secondary testicular cancer. Exposure to radiation, obesity, they are all risk factors for testicular cancer.
What are the warning symptoms?
I urge young men to keep an eye on lump in the testis, pain in the testis, dragging sensation, dull ache, and feeling of weight in the testis.
Why should you do a testicular self-examination?
It is important to do a testicular self-examination. It helps to notice changes, early changes in the testis. When you do monthly testicular self-examination, you'll be familiar with the normal testis. How does your normal testis feel? So if there's any changes in the testis, you will get to know. Change in size of the testis, change in the shape of the testis, lump in the testis or node in the testis, you'll get to know early. The best time to do a testicular self-examination is when you are taking a warm shower or warm bath. At that particular time, the scrotum is relaxed and you'll be able to palpate the testis. When you palpate the testis and you notice that there's any lump or maybe you are having pain, because a normal testicular examination is painless. So when you notice that you do a testicular examination and it's painful, please inform your doctor. However, don't be alarmed if you notice that one of the testicles is slightly larger than the other one or is hanging lower than the other one. Is normal.
How can one do a testicular examination?
Okay, examine each testicle with both hands. Hold your testes between your thumb and the middle finger and rub gently to feel any lump, nodules changing in size or shape.
What is the screening test for testicular cancer?
There is no standard screening test for testicular cancer.
Thank you very much, Ma. See you in our next video where we'll be talking about diagnosis
And
and
treatment.
treatment.